Okay, everyone, this is the exciting panel that I know we've all been looking forward to, and I am very excited to introduce our panelists in order. Our first panelist will be Dr. Melanie Rock, who has postgraduate training in anthropology, social work, and health promotion, the PhD from McGill and MSW from University of Toronto, and also from Université de Montréal. Professor Rock joined the University of Calgary in 2003, where her primary appointment is in the Department of Community Health Sciences, within the medical school. Also at the University of Calgary, Professor Rock has adjunct appointments in the Faculty of Arts, Anthropology and Archaeology, the Faculty of Social Work, and the Faculty of Veterinary Medicine, Ecosystem and Public Health. She is registered with the Alberta College of Social Workers, and honorary affiliations include the Welcome Center for Cultures and Environments of Health at the University of Exeter. We will then be hearing from Kate McLennan, who is a soon-to-be graduate of the Bachelor of Health Sciences program at the University of Calgary. Her studies have focused on social determinants of health, and she recently completed an honors thesis. Kate is passionate about broadening approaches to healthcare and community support. We then will have an opportunity to hear from Valley Fraser-Céline, who holds a PhD in geography from the University of Guelph, where she studied human-African wild dog conflict and conservation in Botswana, Africa, with Dr. Alice Favorka. Following her PhD, she completed postdoctoral studies in community health sciences at the University of Calgary with Dr. Melanie Rock. There, she focused on One Health, reconciliation, and dogs in Indigenous communities in Canada. Currently, she is the One Health coordinator and grant specialist at the Winnipeg Humane Society, where she plans One Health programming with a focus on human dog population management in underserved remote communities across Manitoba. And finally, we will have an opportunity to hear from Taylor Cuestas, who is the Development Officer, Communications and Donor Relations at the Nova Scotia SPCA, where she tends to take work, which is to say kittens home. And with a background in marketing and psychology from Memorial University, Taylor is passionate about connecting people to causes to raise funds and awareness. She holds an honors advanced diploma in nonprofit leadership program and was the winner of the NSCC Alumni Award. In 2021, Taylor was recognized as a 30 Under 30 Innovator by Atlantic Business Magazine, and was also humbly nominated for the Rising Star Award for the Association of Fundraising Professionals Nova Scotia chapter. Over the past 5 years with the SPCA, Taylor has dabbled in everything from program development to digital marketing, and she loves learning new skills to adapt to our ever-evolving animal welfare sector. Taylor believes it is important to embrace change, except for skinny jeans. She believes they need to stay. I am not so convinced. With that, I am so excited to stop screen sharing, and Dr. Melanie Rock, who is awesomely entertaining in her approach to speaking, and I'm making sure that she's spotlighted for everyone. So,
hi.
Dr. Rock, are you going to share your
Yes,
slides?
I can do that.
Perfect.
Thank you. So I'm going to try to do that. Hold on. Stay tuned to your set, please, while we work the magic here.
I love the TV set.
I know. Well,
very nice.
It reminds me of watching Peter Mansbridge read the news at my grandparents' place when he was with Calgary CBC. And it nicely frames out some of the paraphernalia here in my home office. So I'm going to work through a certain amount of material quite quickly. If I am speaking too quickly, please let me know. I'm hoping that I can both see all of the screens and also the chat, but I'm not sure I'm going to be able to do so. So I'm just going to really try to remain calm, cool, and collected. And if there's anything that I'm saying that doesn't register with you, I'd love to hear from you and learn more. Nearly 20 years ago now, I returned to the province of Alberta with a position in what was then a brand new program, the Bachelor of Health Sciences program. And our student contributor today, Kate McLennan, is in that program, which is just so gratifying. And I was in a soft-funded position in the medical school with an expectation that I was going to quickly get some external funding so that I could sing for my supper, so that I could be successful with applications to offset my salary. That was the remit. And I put in 2 grants that year. One of them was a pragmatic grant, I felt, to the Canadian Institutes of Health Research. And one of them was really much more of a thought experiment or thoughtful experiment in living to the Social Sciences and Humanities Research Council of Canada. And I didn't get that CIHR grant that was practical. I did get the SSHRC grant that was aspirational, and that set me on the path that we're going to learn more about today. Now, the first thing I want to say with reference to some of the conversations today is that I don't do myself animal-assisted interventions as a social worker. That's not, I haven't practiced clinically, I never have. However, we can't take for granted that animals of any kind are allowed in cities at all, especially animals who share our lives, our living rooms, our parks, and so on, because it could have turned out very differently. And just as an example, yesterday when I was on a platform, a train platform here in Calgary, along came police officers on horses, a different version of the foot patrol, I must say. And it used to be that horses were everywhere in Calgary and other cities. But after the automobile became our vehicle of choice, literally they disappeared from view. And so I just want to register that thought because that's the basis really for having animals involved in social work practice clinically, but also in daily lives for those of us who live in urban environments. And I'm thrilled to acknowledge members of our team, and I consider alumni members of our team, and so that includes Dr. Fraser Celine. It's important for me personally also to acknowledge the land where I am located on Treaty 7. I was born on Treaty 7 territories in a settler family, and reconciliation with Indigenous peoples is very important to me. Now, I'm just putting up these as resources that highlight that lots of things have changed in our everyday life with animals that are considered to be domesticated. And there have been policies that have changed along with them. Social work as a profession grew up, it developed in relation to animals. And so maybe like you, I took a course where it was presented almost as an anomaly that there was legislation to protect animals, such as horses, involved in as laborers with transportation, with regulating or banning dog fights before there was legislation about child welfare. And in fact, the animal welfare work and that the texts were imported in many ways. And some of the same people, the same advocates were involved in both of these struggles. It wasn't different sets of struggles in many cases. And so that's relevant, I think, for lots of us today. The book Pets in America discusses some of the content and the moral debates that are very important for all of us about language and relationships. And I will say that I found this helpful. And one of them is to say that when those of us who may use the word pets in conversation, including our clients and including community groups, that there's a way for us to reconcile ourselves with this language, and that's about understanding that word pet can mean that we are singling out another being for special attention. So like as in teacher's pet, you know, and I certainly don't want to take away from some of the main messages today about shifting our language and our relationships, but I will use that word, and the City of Calgary does use that word, and so this is aspirational work, but it is also pragmatic. So how do we negotiate some of the parameters and differences amongst us and with our partners and with our clients as we continue to strive for progress? Now, if we think about the history of Calgary specifically, there has been legislation on the books since the 1880s, when it was the town of Calgary, about the conditions under which dogs in particular could be present within city limits. And the original text was literally imported from Ontario, from I believe it was London, Ontario. It was like, get their bylaws and then basically insert them here. That was the message in the archival sources. Maybe unusually or maybe not, there were concerns raised about coyote hounds and how coyote hounds posed a danger or a nuisance for ladies back over 100 years ago. And dogs running so-called at large remained a perennial problem, a cause for complaint all the way through the 20th, the 2000s, the 1900s, if I can say so, because when I try to use the right century, I get a little lost at times. And so I think here we have a very important message that whether or not people would tie up their dogs with a leash or contain them to a backyard really was a question of social norms and expectations. And there wasn't any real way that a limited number of city staff could enforce those rules that were on the books because and it was a he, and the workforce in a municipal enforcement remains I would not say predominantly male, but it is very much a mixed gender workforce. And we should acknowledge that while we are in this Zoom room today, there are a variety of gender expressions and identities that that when we relate to municipalities and other areas of law enforcement, we do end up relating to people who are cisgender men or relate as men more frequently than on our conversations today. So again, that represents a challenge for us in social work as a profession and in allied fields. Now, Dr. Fraser-Selin let me know on a sideline conversation today that the city of Winnipeg, where she is based, also we want to clarify on Indigenous land, traditional territories and she'll be more erudite than me when it's her turn to hold the talking stick. But the city of Winnipeg has just reaffirmed breed-specific legislation. Well, as aspirational as we might be in our Zoom room today, I believe that our aspirations would include ridding ourselves of breed-specific legislation everywhere in the world for lots of reasons that we could discuss further. But those are the realities that we continue to address. And that I believe social workers as a profession and our allies that we could be more effective in combating once we really take on again as a profession the fact that human beings cannot be ourselves. We cannot be ourselves without other species in our lives and in the spaces we share with them. And that's not where social work started. Social work did not start as being only about people. And there's a need, if not to get back to our roots, is to replant our gardens. So the City of Calgary has never had breed-specific legislation, although we came dangerously close in the recent policy review. And many of us were apoplectic, really, that the City of Calgary was publicly contemplating breed-based restrictions. When we see statistical evidence like this, and this is a simple graph, we might like to have more sophisticated information. We have some we can share, but the basic message is this, that the number of complaints about dog aggression, chases, so more minor, but not if you're an older adult or a person with mobility restrictions who falls in a park because of being chased, and then bites with varying degrees of severity. That the dog bite incidents, the number of dog bites per year in Calgary has decreased in terms of a trend over time, even as the human population grew exponentially. Moreover, and this is important for us, of the dogs that the City of Calgary took in or impounded, then the majority, over 80% consistently, are being returned to their legal owners. And of these, about a third were being driven home directly by city staff, frontline officers, in their vehicles, air-conditioned trucks, heating, and so on, while about 2/3 were being picked up directly from animal services, formerly known as a pound. It's not a pound today. And that's not least because the licensing fees for dogs paid for a new facility, city-owned facility, that meets accreditation standards. And then about 10% were rehomed and about 5% were euthanized. When we've investigated conditions under which these euthanasias occurred, then this was after very severe dog bite situations in which it didn't seem possible to rehome the animal. And certainly at the time when these statistics were generated, there was quite close collaboration with the Calgary Humane Society for the prevention of cruelty towards animals. So it's not the case that the dogs were simply being, if you will, dumped at the local animal shelter for nonprofit staff and volunteers to deal with, to take care of. So in many ways, we can see Calgary as a model city. And that's not why I started down this path. I found out about that, as I went along, and I'm proud to have contributed to this model city status to the extent that this work and our team have had what I consider to be positive impacts on policy decisions as far away as Australia, and most recently in Montreal as a metropolitan area, and the province of Quebec. And so I'm not going to go through these dimensions of the Calgary model here on the figure, but I'm very happy to share this information. What I mostly want to emphasize is that municipal legislation like Calgary's so-called model bylaw does involve what we would consider to be animal control. That's been historically how this type of legislation and programs have been described, as distinct from animal welfare. However, we are amongst the scholars and allies and advocates who believe that best practices in this area, in human animal services, do meet the emotional and physical needs of the animals themselves. And that's very important for our discussions today. Now, around dog bites. Well, the last time that the Public Health Agency of Canada's surveillance data on dog bites were reported publicly is nearly 20 years ago. So the babies born then are in high school today, normally, or certainly in the early adulthood. Why don't we know more about what is going on at Sentinel sites. So these is a kind of a collection of specially selected hospitals and emergency departments across the country about what is happening with dog bites. When we know from this work that more children between ages of 5 and 9 received emergency treatment for dog bite injuries than ice hockey injuries, skating injuries more generally, and that 2/3 of infants and toddlers needed treatment because the dogs had bitten their faces, heads, and necks. And then even amongst tweens and teenagers, dog bite injuries still accounted for more emergency department visits than trampoline injuries. With some of the work that we have helped to develop with colleagues at the University of Alberta, Alberta Health Services, we can see from this simple pie chart that the referrals, once children are taken to an emergency department for dog bite injuries, are considerable, and nearly half involved plastic surgery. Fingers. Small dogs can damage fingers. It's not just a question of the size of the dog. And that's really important because often it seems as though big dogs are problems and little dogs are fine. Well, that doesn't reflect the perspective of the children themselves. And social work or a life specialist, child life specialist, was involved as a referral in about 10% of the cases. Okay, more recent, more sophisticated data from the City of Calgary. Breed was not a predictor, did not correlate with dog bite incidents nor severity. Very unfortunately, the City of Calgary had access to this information, but didn't really use that information in their policy review. And when I say had access, I mean that 2 of the people who co-authored this article were actually with the City of Calgary's Animal Services Unit. So somehow the perspectives even of officers in this and other ways did not get taken up in the review. And we have a lot to answer for there. So I certainly don't want to be saying we're doing wonderfully well here in Calgary. We're trying, and I know others are trying, but this is not really a success story. It's a work in progress. So what do we do when, despite having funding from the Canadian Institutes of Health Research and the Social Sciences and Humanities Research of Council of Canada, CIHR and SSHRC, respectively, we didn't really make much of a dent in the policy review process. We need to think about that. As a starting place, we did do a summary of some of the research and channeled some of our emotions into a piece that's been published in The Conversation. There's no paywall for that. There's no paywall either, I must mention, for the previous study either involving City of Calgary data. And this tweet was posted to Twitter the day after the City of Calgary approved changes to the responsible pet ownership bylaw. And we can see that this type of tweet accentuates breed. We've done other work to which Amber Lee contributed substantially about how breed, even in a place without breed-specific legislation, continues to make reference to breed. And where I really want to highlight and the importance of social work today is that we don't talk about dog breeds without talking about the history of racialization. That's where the whole notion of a breed comes from. Specially selected dogs for specially selected people, and then also casting aspersions on people who have the wrong kinds of dogs, who live in the wrong neighborhoods, and so on. That's what happens. That's what's going on here. And unfortunately, this child who was bitten had to go to the hospital, the children's hospital. We don't know whether the adult required emergency medical treatment or not from what was posted publicly. Massive amounts of resources being spent running around trying to look for this dog, when if the dog and the person had been registered or licensed it would have made the job a lot easier. And again, well, certain situations mean that people don't really want to tell authorities where they're living and with whom, including the dogs they have. But telling people they can't have a pit bull or a similar type of dog certainly doesn't encourage people to make themselves known. Okay, so what happens in Calgary? Well, I've given away some of the so-called punchlines in a very nonviolent fashion, apart from the dog bite data, which is very disturbing for all of us, I'm sure. But the new changes include officially limiting the number of dogs and cats that any one human person, can have in their homes. And that's relevant to Amber Lee's Bolton's PhD plans, soon to be or want to be Dr. Bolton. With help from our institution, the University of Calgary, I was interviewed by this journalist, and I did raise concerns about equity and inequity. I couldn't even say anything about the policy process there, but I do have some serious concerns. And by being available to media, then the chief bylaw officer then responded publicly to those concerns, and we've since had some constructive conversations. I can't really explain. I mean, I can and I can't explain why we weren't able to have those conversations before. Turnover in personnel, pandemic, distractions, and also mobility restrictions. There's lots of reasons, but there's no excuses. And there's no excuses for the fact that we didn't have really any support from Alberta Health Services, never mind the Public Health Agency of Canada, while children continue to be bitten on a daily basis, maimed, and sometimes harmed in terms of mental health for life. Now, it wasn't really sensible to have the provincial traffic court decide whether or not a given dog could remain alive. But that's how it was. So I can't really say that the old system was better. The City of Calgary is about to just getting started with a tribunal system. I recently learned that the City of Toronto has had a tribunal system before. There are pros and cons, difficulties always, but also hopefully also some improvement possibilities that exist. However, one can imagine that if you are brought before this tribunal, and if you, and it's probably not going to be any of you, are told that you must now procure professional dog training as a condition to keep this member of your family, that you may not have $450 to spend at the Calgary Humane Society for reactive parent training, for you and your dog and other members of the family. And that's a nonprofit rate. So we desperately do need more people who are dually trained in human health professions, including social work, who also have this kind of training, so that there's some hope that people with less than resources in terms of finances and other social support and so on are not subjected to this kind of treatment because they can't afford official professional dog training. Now, sometimes, as with all members of our families, sometimes staying together is not the best solution for all concerned. But those are hard conversations to have. Where are we as a profession in social work in helping people to have those conversations? I don't think we're anywhere to be seen. And many of our animal welfare charities, out of concern for animals, continue to say that they will not place animals with people who rent, for example, because that's not in the best interests of the animal. They can't be a forever home. What does it feel like to be told that you can't be a forever home? You can't be a foster parent. Where are we in those conversations? So again, there are ways in which Calgary and its responsible pet ownership bylaw can be seen as a beacon, but I would be the first to say that it's a work in progress, and I am less optimistic really about our capacity to partner effectively with the City of Calgary and other organizations than I was even 2 years ago when I was writing out my promotion application. And it was, essentially having to do hashtag humble brag about all this wonderful thing we had done and how much policy influence we had. Well, I'm very glad didn't have to do that last summer. Very glad. And that's all. Looking forward to hearing from all of you.
Thank you so very much. We now have Kate, who is going to present. So there we go.
Okay, perfect. Everyone can see my slides?
Now we can, yes.
Okay, great. So my name's Kate, and I'm presenting some research that I was able to co-author at the University of Calgary. And the title of this project is Leashes, Litter Boxes, and Lifelines, Exploring Volunteer-Based Pet Care Assistance Programs for Older Adults. So to start off with some background, as many of us are aware of, companion animals can support the health and well-being of older adults living in the community. And this happens through a variety of pathways, such as reducing symptoms of depression and social isolation, and also facilitating social interactions with other people. However, lower income and socially isolated seniors face inordinate barriers to maintaining these relationships. Therefore, their companion animals can become a source of stress in these situations. And so Calgary Seniors is a community organization based here in Calgary, and it offers volunteer-based intervention called Pet Assist. And Pet Assist aims to support the health and well-being of older adults who already have relationships with companion animals. And so they support this relationship by providing practical assistance with pet care, and then also through building relationships between older adults and volunteers over a shared love of a pet. So the objectives of my study were to explore how community stakeholders are supporting older adults' relationships with companion animals. And we did this by focusing on assessing the need, the impact, and the feasibility of the Pet Assist intervention. And there's an image here from Calgary Seniors with an older adult and her cat and a volunteer. So for the methods of this study, we had two components. So the first component was an internet-based environmental scan, and we conducted this to search for similar programs in comparable English-speaking countries. So I did this by searching a variety of search terms that are listed on the table on the left side. So I started off broadly, just looking at any sorts of pet care support for seniors, and then moving into also focusing on certain regions where we had heard of some programs. And these programs were excluded if they didn't offer a broad dimension of support. So you can see if they offered only vet or funding services or pet boarding, for example, they were excluded. And so the second portion of this study was qualitative interviews. So we used purposive sampling to recruit stakeholders working in various sectors relating to those relationships between companion animals and older adults. And so we developed interview guides that were specific to each of the role that these different stakeholders played. And then we had 30 to 60-minute interviews over Zoom and the telephone. We transcribed these interviews and then conducted a reflexive and iterative process of thematic analysis. So for the results of our environmental scan, you can see on the left side of the table that Pet Assist was the only program we found that offered all the dimensions of support that we felt were relevant to this model. And this is the only program in Canada that offers these supportive services for multiple species of pets. So you can see there's one other program here from Canada, and this is called Elder Dog. They have chapters all over Canada, so some of you might be familiar with it, but unfortunately their services are only for canine species at this time. And then some other interesting things to note about the environmental scan is you can see that there are quite a number of programs in Australia. And actually every single one of these programs received either state or federal funding or both. And several were run in collaboration with local animal welfare organizations. So for example, after piloting one program through social services, the local SPCA actually adopted the program and now runs it. And so looking at this environmental scan also offered some insights into different training models. So this wasn't available for all the programs, not all of them provided information, but I found for the most part, training focused on human centered factors. So for example, people were trained about safe boundaries between people. However, what was lacking was often training related to animal safety. So the most robust training that we found was in a program in Australia, and they provided human-focused training about safe boundaries and suicide awareness and prevention. And then they also offered training for dog bite prevention. So this was important both to protect the safety of the volunteers who are interacting with unfamiliar pets, and it also improves the safety for other animals and people who these dogs will come in contact with while the volunteers walking them. So now I'll discuss the results of the qualitative interview. So our final sample of participants was 2 volunteers, 1 social worker, and 6 representatives of animal welfare organizations. And we found that theme 1 is it's just one more thing we do to seniors to take away these cherished relationships. So we saw that many of the older adults who are accessing these services were experiencing numerous structural inequities and also endemic ageism. And this ageism usually appeared through paternalistic assumptions that if older adults have any of their own difficulties or challenges, that they're unable or they shouldn't really get to have that relationship with a pet. So there was a lot of assumptions that people's pets should be taken away and that there isn't much value for the pet in maintaining that relationship either. And so in the program, to kind of counter a lot of these assumptions the older adults were facing, there was a really high level of respect for voice and choice. And so one of my favorite quotes from a volunteer was just saying that, you know, you can address issues of animal care through ways that don't make people feel less than. And these are simple conversations that you have over tea. And so people really felt that it was important to allow people to have agency in how they thought that their pets should be cared for within reason of animal welfare. And so theme 2 was really that the lives of these older adults and animals were intertwined, and therefore the quality of life was also intertwined. And so we saw that a lot of these companion animals were also impacted by the disadvantage and marginalization that the older adults were facing. And so oftentimes older adults were forced to sacrifice their own health and needs to support the health of their animal. And we heard from representatives of animal welfare that there's been a rise in medical neglect, and this has actually been the biggest reason for intake, and it's been increasing year over year from the statistics that they have. And so we saw in this quote here that a lot of the medical neglect that they see is preventable. And we saw that these things go to the wayside for both the people and the animals. So many of these people were also having trouble accessing their own medical care, in addition to veterinary care for their animals. And we saw that one of the biggest barriers to veterinary care was the price and also transportation, because many of these people were not able to get rides to and from veterinary care, and that became a big barrier for them. So the third theme was that these relationships with companion animals provided continuity in the face of adversity. So we heard that many of these older adults had experienced numerous forms of loss, such as loss of employment, loss of health, and also loss of other social relationships. And so having this continuity of a pet really enabled purpose and having a sense of routine. And it also ameliorated some of these experiences of social isolation. And then also these relationships that the volunteers built with older adults contributed to this continuity, because many volunteers said that they would be interested in maintaining a relationship with the older adults they met, even if their pet had passed away or was no longer with them. And so theme 4 was that this pet assist intervention is a critical lifeline, keeping people and pets together. And so something that we saw was extremely important, both in the environmental scan and the qualitative interviews, was that it was so important that they had all these different broad dimensions of support so that they could really provide holistic and integrated care for both older adults and their companion animals. And so we saw that older adults work very hard to maintain these relationships with pets. However, needs can change quickly. And so it was often temporary assistance that was needed. However, without this support, they would have been forced to part with their pet. And so theme 5 was about how this intervention built connections that cross species lines and also cross sectoral lines. And so we heard from volunteers that this was a very rewarding experience for them too, to participate in this. And many of them felt that it was simply a lack of awareness of the unspoken need that exists for older adults to have assistance with pet care. And so many people felt that if simply more people knew, many people would be happy to provide these types of volunteer services. And then Pet Assist also really provides that cross-sectoral relationship building, because as we said, and as we all know, these sectors are set up very distinctly. And so Pet Assist is able to integrate these by really being a go-between between the human and animal welfare sectors. So in conclusion, we saw that older adults experience structural inequities and ageism, and this marginalization directly affected the health of their companion animals as well. And so programs like Pet Assist address the need for multi-sectoral interventions that support older adults and their pets. And by looking at the environmental scan, we can see numerous insights into alternative funding, training models, and approaches to partnerships. And then through this research, we were able to strengthen the relationship between the animal welfare sector and Pet Assist, because during our research, we had identified that transportation was a major barrier that was preventing people from accessing care from animal welfare. And Pet Assist is a program that helps with transportation and is very well equipped to provide rides and also support and assistance during veterinary appointments. So that's everything for today. I would just like to acknowledge that this research was funded by the O'Brien Center for the Bachelor of Health Sciences program. And my supervisor for this research was Dr. Ann Toohey, and our principal investigator was Dr. Melanie Rock. And we also could not have done this without the collaboration of Emma Matos, who's the senior program coordinator for Pet Assist at Calgary Seniors. And she really designed this project with us from the beginning. So now I'd be happy to take any questions.
Thank you so much. I think we might wait for questions at the end just to make sure that everyone has enough time, because I feel like we could dive deep into everything that you just said.
Absolutely. Sorry, one thing too is I'll just share the
please.
link to that article in the chat. It's open access, so feel free to share it with anyone you like.
That is awesome. Thank you so much. All right, I am going to now replace the spotlight with Valley, and Valley's going to share slides, and I'm excited to learn from Valley.
Thank you, Anne. I'm just switching to presenter view here. Great. So everyone can see my slides. Hopefully I can't really see anyone. So
you're perfect.
Oh, great. The trouble of Zoom conferencing these days. So hi, everyone. I'm really excited to be here, and I just want to thank Amber Lee for inviting me to be on this panel today. And before we begin, or before I begin, I want to acknowledge that I am speaking to you from Treaty Number 1 territory, the traditional lands of the Anishinaabe, Innu, Oji-Cree, Dene, and Dakota nations, and the homeland of the Métis. At the Winnipeg Humane Society, we respect our partnerships with Indigenous communities, and we work together through collaboration and reconciliation to support animal, human, and environmental health. So in my role at the Winnipeg Humane Society, I work with remote communities in Manitoba on One Health programming with a focus on humane dog population management. And most of the communities that I partner with are First Nations. I'm committed to learning about reconciliation and building long-term relationships with those communities that are built on trust. And today I hope to give you some insight into the situation of dogs in remote communities in Manitoba, and how we at the Winnipeg Humane Society are supporting those communities through our programming, and in particular how our work focuses on promoting equitable and accessible animal and human health services across the province of Manitoba. So I know most of you are familiar with One Health, but I just want to give a quick definition from the World Health Organization first. So One Health is defined as the use of multidisciplinary approaches in the implementation of policy design and public health interventions. It recognizes that the health of humans is intricately tied to the health of animals and the environment. A One Health framework really enables collaborative initiatives across, but not limited to, animal welfare, veterinary medicine, public health, human health, conservation, ecological sectors, and of course, what we're all here for today, the social work sector and animal assisted interventions. So One Health is really relevant to us as we talk about animals in these different spaces. And during my postdoctoral studies in community health sciences with Dr. Melanie Rock, we also viewed the environment, which right now is really defined as ecosystems and ecology, but we viewed the environment as the social environment. And so by providing equitable access to veterinary services, we are contributing to a healthy social environment in these remote communities across the province. So while we focus predominantly on animal health, we recognize that we are contributing to the health of people, the health of the communities, and public health more broadly. So I'll just tell you a little bit about dogs in northern Manitoba. So our focus, first of all, is predominantly on dogs, although we do see cats as well at some of our clinics. And this is because of the public health and safety concerns and animal health concerns in remote communities due to predominantly the lack of access to veterinary services that are equitable and, of course, accessible to the communities. So just a bit of the lives of dogs in these communities. You will see a lot of dogs that are free roaming. Many of these dogs are owned, and they just kind of, free roam throughout the community. They may access resources, by people feeding them or different folks feeding them, or even their owners feeding them, or they might just grab food at the dump or at different areas in the community. Then we also see, non-free roaming dogs. So we are seeing a lot more house dogs in remote communities. A lot of these dogs are, a variety of breeds. We might kind of think of these northern dogs like what you see in the photo now, but we are seeing a lot of Shih Tzus and Chihuahuas and even bigger dogs like Mastiffs and Great Danes in remote communities these days. So there is this shift from the kind of husky looking dog that we're seeing to a breadth of breeds within remote communities up north. And some of the issues that we see in communities that are public health concerns are really focused on dog bites. So predominantly children are at risk, as Melanie was talking about in her presentation. Dog bites are largely under, they're not necessarily, we don't see a lot of kids in hospitals or, coming from Indigenous communities. So dog bites are really a huge problem, and they're very much underreported in these communities. For example, one of the big incidences that we had just in the last few months was in a very remote community of Shamattawa, and there was a child who was mauled by dogs and had to be airlifted to Winnipeg to receive care. So there's not even enough care in the communities to deal with a lot of these dog bites. And of course, with dog bites come, the threat of zoonoses, rabies in particular. We don't see a lot of rabies in Manitoba, but obviously this is something that is very concerning when we do. We have started to see some rabies this year up in Churchill through the foxes. And so the other issue is also parasites. Sorry, my dog is poking his nose in. Of course, what would it be without a dog, running around in our presentations these days? But yes, so we do see a lot of threats of parasites being, passed on to children, especially as well. And we are, Indigenous communities, there is the stress that in urban areas we don't necessarily face because we don't have these large groups of free roaming dogs that are, potentially trying to access resources around the house or are, accessing a female in heat at the house. This can be very stressful for people who want to walk around in their communities when there's these large groups of dogs, and especially children who are, walking to school or playing outside. And some of the animal health issues that we see is the lack of veterinary services. We do see a lot of preventable diseases such as parvo and distemper in remote communities. There was a community called Moose Lake that had a huge distemper outbreak in the last few years, and it affected the majority of the dog population in that community. And another thing is access to food and shelter, especially during the winter months. Just as an example, food in a northern community, like a large bag of 23 kg food that you could buy in Winnipeg for, $40 or $50 is $120 in remote communities. So food is very, very expensive for pets, let alone for human food as well. And free roaming dogs especially are prone to injuries. So they may be hit by cars or get into dog fights, and the lack of veterinary services in the communities means that some of these dogs are walking around with injuries for quite a long time. So that affects their health and their welfare. And due to the public health concerns such as dog bites and zoonoses and stress, we are seeing dog calls in communities. Oftentimes the communities have no choice but to resort to dog calls. So for example, the community of Shamattawa, where that little girl was mauled, they ended up doing a call of 100 dogs in the community. And that, kind of brings it back to this, these mental health issues where, people are seeing, their dogs or their neighbors' dogs being shot. The dogs may not be killed in a humane way. So this brings up a lot of different concerns in the community when it comes to One Health, especially. So what are some of the barriers to accessing veterinary services? So I know I've talked about remote communities, but maybe I can give you a bit of an example of the geographic barrier that this presents. And maybe you'll have a better idea of what I mean by remote. So one of the communities that I am starting to build a relationship, it's a community in northern Manitoba called Wasagamacq. And the only way to get to Wasagamacq is to either drive in the winter. So you would drive on the winter road and then cross the lake on an ice road. Or you would fly to a nearby community and then drive over the ice road. Once the ice starts to melt, people switch to skidoos to get to kind of the main other area where they can go shopping and do all their things, or fly to down south. So you go from ice road and truck to skidoo, and then when the ice is melted too much for skidoo, then they switch to helicopter. So the only way to get to from Wasagamacq or to Wasagamacq is by helicopter for a short amount of time, and that is very, very costly. And then once all the ice has been broken up, then they switch to boats. So geographic isolation for remote communities is a huge barrier to accessing veterinary services, especially if you need to fly a dog in and out of the community. That can be quite expensive. And that brings us to the financial barriers of accessing veterinary services. It can be very expensive to not only bring your dog, down south for veterinary services, or to one of the two veterinary clinics that are above the 53rd parallel in Manitoba that service over 25 communities. That can be very, very expensive, not only bringing your dog to the vet and the cost of veterinary services, but also accessing those veterinary services geographically and transportation wise is also a huge issue for accessing those services. And also there may be a lack of knowledge in certain communities about spaying and neutering and about vaccinations and how long vaccines last and how long spaying and neutering lasts and what are the benefits of spaying and neutering. So that's also a big barrier to accessing those services. And of course, we all know that there's a shortage in the veterinary community these days, not only in easy to access urban areas, but even more so in the remote areas. So like I said, above the 53rd parallel in Manitoba, which is what we consider remote, there are only 2 veterinary clinics servicing all of the communities in that region. So that's a huge problem as well. So while veterinary services are not directly mentioned in the Truth and Reconciliation calls to action, since they fall under this umbrella of One Health, we can position them in the calls to action, and in particular in call to action 19, which focuses on health. So call to action 19 states that we call upon the federal government in consultation with Aboriginal peoples or Indigenous peoples, Aboriginal's a bit outdated, to establish measurable goals to identify and close the gaps in health outcomes between Indigenous and non-Indigenous communities, and to publish annual progress reports and assess long-term trends. Such efforts would focus on indicators such as infant mortality, maternal health, suicide, mental health, addictions, life expectancy, birth rates, infant and child health issues, chronic disease, illness and injury incidents, and the availability of appropriate health services. So by focusing on call to action 19, we're aiming to close those gaps in health outcomes between Indigenous and non-Indigenous communities. And we're also touching on mental health by reducing the stress of walking around in communities if we can address the overpopulation of dogs and that grouping that occurs when there's overpopulation. We're trying to reduce injury incidences, especially for children when it comes to dog bites. And we're trying to also increase the availability of appropriate health services that are relevant to the communities that we work with. So I'll give a brief overview of the One Health program at WHS. It's quite a new program and we are growing. But right now we focus predominantly on veterinary services, and this is always at a reduced cost. So for example, our services for a spay and neuter would be $85 for folks in remote communities, and that includes a physical exam, surgery, vaccines, so rabies, parvo, distemper, as well as parasite control. And that is comparable to potentially between $400 and $800 in urban or more northern areas as well. So we do a lot of spay neuter clinics. We've helped over, we've done some spaying and neutering for probably over 20 communities in Manitoba, and there's 63 First Nations in the province. We also do wellness and vaccine clinics as well, and we are able to provide urgent care for some of those dogs that may be quite sick or injured that are flown into Winnipeg to receive care. Sometimes they are relinquished to the Humane Society or to a partner rescue that then gives ownership over to the Humane Society, or sometimes we do spay and return or spay neuter and return as well. So we also want to grow our knowledge sharing programming with grade school and high school students, so that we can integrate more of animal health and welfare programming into schools. And we also provide pet food we did that during COVID as well, because a lot of the communities were shut down and there was no going in and out of the community. So there was a large issue it's a big issue with access to pet food. And we've also provided dog houses as well, or facilitated the provision of dog houses for some folks in remote communities. And of course, we're always trying to focus on community engagement and relationship building so that this program can become sustainable in the community. And we have some programming that we're working on, for example, a lay vaccinator program that would make sure that community members can vaccinate dogs within the community so that we can get more vaccines into dogs rather than always relying on service provision from outside of the community to come in. So I hope that, one thing I'd like to add is that we're always doing everything by consent. We always receive consent from owners or from chief and council to spay, neuter, and vaccinate. And we are always invited into the community by leadership. So we never just go into a community and do a clinic without leadership knowing. So that's another way that we focus on building relationships and addressing reconciliation when it comes to service provision. So I hope that I was able to give you a bit of an overview of the programming that we offer through Winnipeg Humane Society and how this is related to One Health and reconciliation when it comes to veterinary services and dogs in remote communities. Thank you.
Thank you so very much. And we are excited to now invite Taylor Hewis to share a little bit. And Taylor is here in Nova Scotia with the SPCA, as I had shared earlier. So I'm going to just share my screen for Taylor. And here we are. Hopefully everyone can see that. All right, go for it.
Wonderful. All right. Hi, everyone. Before I begin, I just wanted to acknowledge that I am in Mi'kma'ki, ancestral and unceded territory of the Mi'kmaq people. We are all treaty people. So my name is Taylor Hustis, and I'm the Development Officer, Communications and Donor Relations here at the Nova Scotia SPCA. I almost always have foster kittens with me, so this feels super strange to not have a cat on my lap. So I'm like, what do I do with my hands? But yes, so my background is in marketing and psychology from Memorial University. I also hold an honors advanced diploma in NSCC in the nonprofit leadership program. I'm a big believer in that even though we are a nonprofit, we need to have a business sense that helps lead our decisions and allows us to evolve with our ever-changing and growing animal welfare sector. So I've been with the Nova Scotia SPCA for the past 5 years now, and I've already witnessed so much growth. Before we get into that though, I'm just going to do a quick overview of the work that we do and the challenges that we're facing. So if we can go to the first slide there. So the Nova Scotia SPCA fully amalgamated in 2016 into one organization. So all 6 shelters here in the province are governed by the same board of directors and follow the same animal care procedures. This was a big game changer for us. So now if an animal is for some reason not getting the attention that they need to get adopted, or if a shelter is totally overwhelmed and needs that extra support, we can transfer pets around to each of our shelters. It also allows us to take full advantage of now having our in-house clinics and our animal hospital. So we can do surgery sometimes at 1/3 of the cost than outsourcing it and really maximize that donor funding. So finding these innovative ways to save money is crucial because we don't receive any government funding for our shelters. So important supplies like food and medicine are entirely covered by donations and fundraising. So at our core, here at the SPCA, we stand for the 3 R's: rescue, rehabilitate, and rehome. So for rescue, animals come to safety at the SPCA through a number of ways. Some were abused or neglected and were seized from enforcement officers. Others were abandoned, or they've come to us when their owner passed and they had nowhere else to go. So we're proudly open to mission, and we follow no-kill principles, which means that we will never turn away pets in need or euthanize for space. We accept animals into our care regardless of their age, health, or breed. The second R is rehabilitate, and this looks different for every pet. So for some hurt and injured pets, they're rushed in for emergency veterinary care at one of our SPCA animal hospitals or clinics, and it may mean that they need life-saving surgery or medicine to help ease the pain. And some pets need to heal physically, whereas others emotionally. So in our shelters and with our trained, dedicated foster families, we work around the clock to help rebuild their trust and show them that humans are kind and loving. And when pets are in foster care, the SPCA provides everything the pet needs to have a comfortable stay: litter, food, toys, you name it, we will supply it. And foster families provide that socialization and help build their confidence for a promising future. And then finally, the most rewarding but bittersweet R is rehome. So it really is a roller coaster of emotions. Sometimes it is impossible not to get attached. And although we are so excited for the pet to start that next chapter, it can be really hard to see them leave. But we always remind ourselves that goodbye is the goal. So we help to pair pets up with their perfect match. And usually what ends up happening is, on average, healthy and super friendly pets are adopted into loving families in less than 2 weeks. So other pets may have more unique needs and may take more time. Some pets have taken more than 200 or 300 days, but no matter how long it takes, we never give up finding their happily ever after. You may notice that we don't say forever family here. And although that would flow so easily off the tongue, and I love my alliteration, we all know that language has power. And more than half of the pets that come into our care are surrendered, whether it be a change in lifestyle, allergies, moving, or they cannot afford care. And we notice that our biggest thing that we're feeling here is that we're battling a negative connotation about animal surrender. So although some folks say that they could never surrender or never understand how someone could surrender a pet, they don't know the circumstances that that family is under. And in reality, animal surrender can be the right and totally selfless thing to do to make sure that that pet gets the care that they really need. It is already very difficult emotionally to do, so we want to do everything possible to alleviate that stigma. So just because it wasn't forever doesn't mean that you're a bad person or a pet parent. Life happens, we understand that. So if we change the slide, just to get an idea of the size of our organization here, last year we served 14,846 animals through animal rescue and our programs and rehoming opportunities. We performed 6,332 surgeries for pets in need and helped 3,733 pets find loving families. We have a $6.8 million annual operating budget, and more than half of our expenses are shelter operations and vet services and medication. So today I was hoping just to share some of the challenges that we faced over the years, and then the programs or direction that we have taken to try to get to the root cause of that problem. So we'll go to the next slide. So when the SPCA first started, we were best known for adoption. Although we've had everything from roosters to bearded dragons, we primarily help dogs and cats. So in 2009, we noticed that we were receiving a lot of elderly animals with health concerns. And although they had so much zest for life and their health concerns were totally manageable, the cost of their ongoing care and their age was a big barrier to them being adopted. So we came up with the SPCA palliative care program. To some, they associate the word palliative with dying, but our program is all about living. Families agree to foster their pet with no adoption fee at all and give them that loving retirement home. And the SPCA provides all the medical care at no cost to them. This program has been a big success and is a big part of our no-kill mandate. To date, more than 109 animals have participated so far. So we'll go to the next slide there. So we've talked about some older pets, but what about the younger ones? So we noticed that we were seeing an uptick in the number of young pups surrendered into our care for behavior. So it really inspired us to get to the root cause of that. We created the WOOF program. WOOF, which stands for Working on Our Futures, is a joint initiative between the Nova Scotia SPCA and the Department of Justice. Young puppies actually go into jail and are trained by the inmate and a professional trainer. For inmates, it's an opportunity to really learn responsibility, how to show respect and patience and care for an animal. And that's skills that can help change the direction of their lives too. And then puppies learn all the basic commands and are truly set up for success. It's really, I guess, a story about second chances for both. And more than 680 puppies have participated to date. And then another big program for tiny pups and kittens is our pup program. So we understand that accidents happen and many unplanned litters are born because pet owners don't realize that babies can have babies of their own. So PUP, which stands for Prevent Unwanted Pregnancy, helps families who suddenly find themselves with lots of new sets of paws in their house. They just have to contact us to book an appointment, and we will fix and return their female dog or cat for free, no cost at all. And we will fully vet and find loving homes for the puppies or kittens. That way, there won't be any more surprises. So we'll go to the next slide. And then 3 years ago, we embarked on a journey to find ways, aside from low-cost spay-neuter, to help keep loving families together. I was completing my nonprofit leadership advanced diploma at the time, and for my capstone project, we had to find a problem in the community and attempt to create a plan to help solve it. Naturally, working at the SPCA, I wanted to find something that could also work here. I was digging into the reasons why animals were surrendered and was shocked to see that our numbers had really shifted. more than 14% of pets were surrendered because their owner was fleeing domestic violence, facing homelessness, or needing hospitalization. And without a close family member or friend to look after their pet, some owners were reluctant to leave abusive situations or seek treatment to help them heal. We all know that the comfort and love that pets can give us, especially during difficult times. So I was inspired to try to find a way for us to be able to help pet parents during these times. Pause and Support was born. So with Pause and Support, owned pets are cared for free and are reunited once their owner is in a safe, healthy, and happy space. Sometimes this means that we medically treat and care for the pet for more than 3 months, but we developed this program to ensure pet owners can feel confident their pet is well cared for while they focus on their own well-being. And then the next one was the pet pantry. So this launched as well because we were finding that a lot of pet parents were reaching out to us in need of food, especially in the very height of the pandemic. So maybe they've lost their job or something has happened and they're behind on rent and they just need a little bit of temporary support to get them through this difficult time. So with that, it's completely contactless and completely for free for them as well. They just reach out to us. They let us know the breed, the age, and how many animals they have, and we'll be able to put out some food for them. And we're also looking into delivery options right now as well. So we're testing that out to be able to see if we can actually add that into our grant proposals for the future, because we know that sometimes transportation can be a barrier to this as well. So thankfully, we did have these programs in place before the pandemic hit, because with COVID-19, the need and demand for both Pause and Support and the pet pantry has grown by 66%. And then if we go to the next slide here, finally, these are just our two newest ventures and what we're looking forward to in the future. So first off, our SPCA Veterinary Hospital. So to address those root causes that animals are surrendered because of cost of medical care, we were really determined to make this hospital for owned pets a real reality. So it is the first and only full service, not-for-profit animal hospital here in Atlantic Canada. So we provide accessible services like spay neuter, vaccines and parasite prevention, medical and surgical treatment, microchipping, dental cleanings and treatment, and diagnostic exams and x-rays. Basically everything. And we also opened up a Sunshine Fund. So with the SPCA Veterinary Hospital and the Sunshine Fund, profit from the hospitals are used to care for pets and families that are in crisis and they need that support. So the Sunshine Fund really gives that dignity to pet owners, and it also gives hope for hurt pets. So we're able to get them in and to make those and to really subsidize those surgeries so that they can get that immediate care that they really need. The biggie right now that we're focusing on is our goal is to really raise animal welfare and to build strong communities. And this is a giant goal and it can be difficult to know really where to start. So we went back to the very beginning with education. So we are investing in high quality education and promoting diversity, inclusion, and belonging. So in 2021, our dream became a reality and we opened the doors and welcomed students into the brand new Nova Scotia SPCA College of Animal Welfare. So our first program, the Veterinary Assistant Diploma Program, that launched in September with a very small class of 10 students. And this program teaches outstanding client services with the knowledge and passion for animal care. And to ensure that tuition and the ability to pay that tuition wouldn't prevent people from enrolling, the first class all attended on full scholarship. And then furthermore, the program was a pathway to employment. So graduating students are all guaranteed a job with the Nova Scotia SPCA. And this upcoming September, we're going to be expanding to be able to offer both the VA program, but also a veterinary technician diploma program. So we're really, really excited about that. And then once we finish off with that, who knows what the future is going to hold, but we would love to be able to offer online services as well. That way people from all across Nova Scotia and maybe all across Canada can use these. And then I think that's all I have to share today, but I'm very open to questions and chatting with you guys a little bit more.
Okay, thank you so much. I think that we need a joint social work veterinary certificate. I personally am very inspired, and my two babies that I got about a year ago from you all are very grateful for the love and care they received. So with that, we have a little bit of time for a few questions. I know we've kind of run late, but we still want to make sure that everyone is having a chance to ask some questions. And so I'm in the process of, there we go. If anyone has any questions. So one of the questions is, are the families required to surrender their mama dogs? Hold on a sec. The mama dogs to be part of the pup program?
Nope.
No,
The great thing about the pup program is when we had first started it, what would end up happening is we would take in the puppies or kittens and fully vet them and make sure that they couldn't have any more accidents of their own, and then find loving families. But we found that the families were calling us maybe every year, every 2 years with the same issue, saying, oh, we've had another accidental litter. So with that, we were like, you know what, we really need to expand this and to be able to help that mama to not have any more babies. So that's why we offer that spay for the mama dog or cat completely for free, and they're reunited back with their owner.
Another related question, is the palliative program something that the pet needs to be surrendered to access, or can families access that support while keeping their pets at home?
Yeah, so right now with the palliative care program, what ends up happening is that they are surrendered into our care, but it is something that we would love to be able to branch out. Now with our SPCA veterinary hospital, we believe that we will be able to provide that service to them so that they can have that accessible healthcare and not have to surrender their pet. So the palliative care program will probably look a little bit different now that we have the hospital open, and now that owned pets can really utilize those services.
Awesome, thank you. There have been some great questions and comments about MSW placement at SPCA shelters. This is obviously a phenomenal opportunity for families who are struggling to get resources and connected to resources. And I'm excited that I have a social work student here, Amber Gallant, who's working on developing some MSW placement opportunities in the future for us. So I know she's taking notes right now, and we will probably be following up with Taylor on that, because that's a pretty awesome opportunity. Now, this is an opportunity to hear not just from Taylor, but Kate, Melanie, Valley, and Cassandra and Amber Lee, because they really organize this entire day. And we are, resting on the strong foundation of their research. And Cassandra, you look like you were getting ready to say something.
I just wanted to mention that there is currently an MSW placement happening at the Nova Scotia SPCA.
Ooh, that's great to know.
Yeah. So it's the first of its kind in Atlantic Canada, and we're hoping, it's just be the first of many more. But just as I was listening, Taylor, to your presentation, I'm thinking it'd be great if you came at some point in the future to do the same presentation at the School of Social Work. And virtually every program that you're offering benefits the animals involved, obviously, but to the people, right? So that those programs are really getting at the intersections of human well-being and animal health. So they're truly One Health programs in that sense. So I think that just from a social work perspective and students in training, it'd be very helpful for them to be aware of the SPCA programs. And this goes for the others that have been talked about today across Canada, because often then future social workers can add these programs to their list of resources. Many do come into contact with clients with companion animals in their care, and they have questions. So just to know, they can start to refer out to, there's a program at the SPCA that I think that you could benefit from. And yeah. Because I won't take up more time, but what I did want to say at the top, that listening to all of the speakers and the programs that they're involved in and dedicate their time and energies to. I mean, it's just wonderful. And what I would like to suggest is that it's the promotion side of it that so often the animal welfare world is siloed out from the human welfare world. You know, there's these parallel tracks that don't often cross over. And there have been calls for cross boarding,
Cassandra,
you know,
I'm going to interrupt
because
you and
social
ask,
workers are often. Yep.
I'm going to ask you to just turn your camera off because you're we lost part of your sentences, but stay unmuted and keep speaking. It just, this way we hear all of your words.
I don't have much more to say. I was just saying that there have been calls in the past for cross training and cross reporting and training between animal welfare workers and human welfare workers. And though it hasn't been picked up on a policy level, and it hasn't been integrated into into curriculum programs. Yeah. And I really think that's the next direction that we need to move in, because so often social workers, among other health care practitioners, are the first respondents into homes where they witness either animal cruelty and abuse that we know is a precursor often to other forms of community violence, interpersonal violence, but there's no training. It's like, they look after the people and make referrals out, but the animals are left there. Or and conversely, with animal welfare, protection workers will go into homes and address cases of alleged animal cruelty, but then often they may observe or have a sense that something amiss is going on in the home. And often families where animal cruelty is taking place, need help in other ways, right. Putting the animal in context. So yeah, a lot came to mind, but I think that's the path that we need to travel down, is make promotion work around all of these really terrific programs, and getting the welfare and the animal welfare and human welfare sectors to have more conversations. And it's like the cross-pollination of things.
Absolutely. And speaking about cross-pollination, Gabby's here from Michigan State University. And this session is being video recorded, so you can contact us at the Nova Scotia College of Social Workers, or like us on Facebook, and we will be posting this. And you can use this in your own advocacy to create placement for yourself. In theory, if you contact your SPCA and maybe find a MSW who can supervise you, you might possibly be able to create your own placement for yourself, and this might be an important stepping stone for other students who might be interested in that interdisciplinary approach. Because if you think about what Cassandra just shared, really when you see issues of abuse in one area, you have, or families that are struggling, it's usually a cry for help that there's many other needs that are in need. And I love, Melanie, you're doing some great sharing here. Anyone else have any other questions for any of our speakers? I feel like this is just the first of many more, much more research that needs to happen, and much more sharing and dialogue. I know for myself, my mind has been open to some of the ways in which I use language. I don't even know if I should use that word, but anyways, the ways in which my language perpetuates harm and stigma around transspeciesism or lack thereof. So I'm grateful for my own learning. Cassandra and Amberly, do you have any final comments that you want to share? You just muted yourself, Cassandra.
Oh, I just wanted to say too, though, I'm thinking about, Taylor talked about future programs with the one college, and Melanie made the comment that we need more trained animal welfare personnel out there, and I couldn't agree more. And so I think those are two areas. I think humane education is something, the concept, it's an idea that's been around for a really long time. I remember hearing about it when I was young, but it's grown so much since since decades ago. And I don't think we give it enough credit. I don't think we give the concept of humane education, whether we stick with that language or not. But it was just the idea of loving kindness towards other, sentient beings and non-human animals, I think could go a long way in the public school system. And courses at the one college, at any school, make humane education a part of social work curriculum, using a One Health framework or lens. Another interesting program that we have examples of in the United States is the veterinarian social work program. There's 4 pillars, which is, which animal-assisted interventions are one of the pillars. Compassionate burnout and is another one, and so on. And so there's 4 pillars, but that would be another, ideally I'd love to have that as a certificate at the School of Social Work where I am, as a subspecialty for graduate students, but I could see it being something that could also be handled by the college at the Nova Scotia SPCA or any other learning institution. But anyway, just some ideas of
I love this.
Of some of the work being done.
Very exciting. Thank you so much. Amberly, do you have any final closing words?
I'm not sure where people's energy is. I was thinking about a question for Valley. Some of that too. And I was thinking about, and some of this goes back to our experiences and Melanie's research and the team as well, that with the seasonality kind of dog bites, and we know with rabies and everything. And it really struck me when you were talking about the ice roads too, and getting up into these remote communities, like how, so I was wondering how much pressure is there kind of around getting up to these communities while you have access via road, and then what happens like once things start melting and in the springtime? Like, do you have to shift your focus kind of with the seasons each time and how you're communicating and doing this work?
Yeah, that's a good question, because we are really reliant on, the most kind of cost-effective way to do these clinics. It's very expensive to do a spay neuter clinic in a remote community. It can span from, between $10,000 and $15,000 per clinic. So of course, getting across the ice road is probably the most cost-effective way to get there. We're definitely not transporting everything via helicopter. That would be like crazy. But, I know that sometimes they have taken the boat across, but the equipment's the huge problem, right? Like our equipment's probably about 800 pounds of, veterinary equipment, because we'll set up in like a gym or a community center or a church basement or something. So we do kind of focus our spay neuter clinics more so in those seasons where it is easier to get to the community, depending on where the community is and how to get there more easily. We are also starting an implant program for winter clinics, right? So we'll go, which basically the implant is just like it's like a vaccine. Basically, it's just a bigger needle, and it's like a little grain of rice that you implant into the dog, and then that is a basically a chemical non-surgical spaying and neutering, and it lasts about a year to a year and a half, sometimes even longer depending on the age of the dog. So that's a really great way to kind of tide us over until we can get into the community to do surgeries rather than implants. So that's something that we're starting to do more in communities that are really, really remote and difficult to access. And that is also something that we want to start doing more in the winter, because surgery, for dogs that are predominantly outside, if they have shaved bellies, that can be, harder on them during the winter if they are, they don't have a lot of, they're not kept on porches or anything, or if they're tied up in a dog house, it can be a lot colder when it's -45 on a shaped belly, obviously, than when you have more fur. So these are all things that we think about when we're planning our clinics and where we go at what time.
Thank you. Any other comments? I feel like we could do, I think we just need to leave you wanting more, and we will have to have more conferences and research and sharing moving forward. I know I am very grateful for today's session. Definitely want to thank Dr. Cassandra Hanrahan as well as Amberly Bolton for all of their hard work preparing for today, and our panelists, Melanie Rock, Kate McLennan, Valley Fraser Celine, and Taylor Hustis. So grateful to each of you. And we're going to end with just what can you do? Obviously volunteer with Elder Dog and SPCA or elsewhere, but since tomorrow is National Pet Therapy Day, this is a little slide. I don't know, Amber, if you or Cassandra would like to say something about here.
No, we just wanted to, it happens that today's event was 29th today, so it coincides with the recognition day for pet therapy tomorrow. So in honor of all of those of you who do animal-assisted interventions and therapeutic work and work focused on welfare, thank you. Yeah, there's these links aren't live here on this forum, but if you would, this is through Pet Partners. That's the organization in the States that established this day of recognition for pet therapy. You can go to their site and you will see you can use these links live, but we just wanted to make people aware of it. It's a relatively new initiative. Yeah. And I just want to say thank you, a heartfelt thank you to everyone, the panelists for sharing all the good work, to Amber Lee, the Nova Scotia College of Social Workers, the study participants. I've really enjoyed hearing from all of you, and I'm going to have to go back and read the chat. There's so much interesting ideas and connections and resources being shared. I want to just say, though, what came to mind, like what I'm going to go away with myself is just, it's being reinforced again for me, the crossover between animal welfare work, animal-assisted interventions, and therapies included, and social work, which is the profession in which I'm located. And just listening to the discussions and presentations around dog bites and the crossover with how we think about adverse or violent behavior among people, and we know that we don't treat people with, like the idea of a bad person. I think the ways that we don't do that in the social work world, I think we can learn from that and how our interactions with animals too, that, this idea of a bad dog. That taking dog bites, for instance, in context, and usually always there are mitigating human human behaviors that are in at play. So I just think there's so much crossover and so much learning to be had, and that the idea of One Health, which many of you have talked about today in reference, its origins of one medicine, when truly animal medicine and medicine for people were one, and that was the precursor of One Health today. We've sort of forgotten those early roots, but I think now we need to, in this world that's so compressed, that we need to go back to that, and that there's more similarities and there are differences.
Thank you. And
thanks,
Rebecca
everyone.
just put in the chat the Pet Partners Campaign for National Therapy Animal Day, the link, so you can go and share it or be inspired as well. And please share some of your own reflections or takeaways. We have a couple of moments left, and again, thank you to everyone. Thank you, especially Dr. Hanrahan and Amber Lee. It seems like many years of your work came to a culmination today. So we are so grateful for that, and look forward to more of your sharing of your research and findings. Amber Lee, the connection between hoarding and caring for animals is something that I am going to follow up with you about, because we definitely want to elevate that voice. Lisa's sharing also that we don't want to lose the message by being focused on language. So how do we balance language with message? And that's also very important. Thank you. Any other? All right, well, like us on Facebook, because we are going to be posting these videos shortly. We have to upload them and all that fun stuff. But again, thank you to all, and we will see you soon. Don't forget to register for our upcoming conference, our annual social work conference, How Do Social Workers Lead Transformational Change? And that's going to be May 13th and 14th. It's going to be an awesome, amazing 2-day experience with lots of research and advocacy and insights, lots of panels, multiple perspectives, and some breakout groups so that we'll be able to do that. So just like us on Facebook, NSCSW, Nova Scotia College of Social Workers, and it'll be a post that we will share. So yeah, thank you all.